I want to go to Erling Falk, the father of plaque rupture. Erling?
Yeah. I don't think I can say so much that has not been already said, but you mentioned our vision was to identify, to find the vulnerable people and treat them before they got the heart attack. We are talking on primary prevention, not the people that already they are asymptomatic.
Yes.
And what have we achieved in the last 15 years or something like that?
What?
What have we achieved in that aspect? We have talked about coronary calcification. Yeah. We have talked about carotid ultrasound. But in fact, they may improve risk assessment, but even heavily calcified coronaries will not come close to a risk of 25% of 50 in 1 year. So we are talking about something else. I think we can do risk assessment better, and I think we should be able to improve it beyond the traditional framing and risk factors. And with the new tools available and detecting multiple biomarker and just the and machine learning, we will be able to do better risk assessment. But I don't think we come close to, in an asymptomatic person, to identify one that have 25%.
1 out of 4 will have an event in the next 12 months.
No, I don't believe it.
Well, we're going to have to make you believe it. So we're going to have to show you.
But I think of course we should be able to do risk assessment better than we are doing.
So imagine we have 2,000 vulnerable patients from this 20-some cohorts. These are people who died or had an event.
But you assume there is a signal.
What?
You assume there will be a signal present in these people
that
are
I just have, you're right. My philosophy is,
it just happens.
It's not earthquake, Erling. It's not earthquake.
I think about earthquake.
Yeah, remember?
I think about earthquake.
We had a motto when we started vulnerableplaque.org. Heart attack is not an earthquake. It can be predicted, therefore prevented. This was 17 years ago with our first meeting. Unfortunately, we haven't cracked this code yet, but I really believe that with all the things that we have seen, have you said, how many of you guys have you driven Tesla on driverless mode? I did, and I was frightened on highway, completely driverless, and I was texting. If that much advancement could be made in the last 5 years, less than 10 years, with machine learning, all these genius approaches, we gotta do that. We have to, it's our job to bring that to our field. So I think with this unique subset of data that we're putting together, we have the opportunity. Okay, sorry.